Hi, I'm Dr. Matt Davis. I'm the director of the C.S. Mott Children's Hospital National Poll on Children's Health. I'm here today at the Gerald R. Ford Presidential Library on the University of Michigan campus in Ann Arbor, Michigan, and I'm here today to talk with you about the latest results from the National Poll on Children's Health. In 2012, a presidential election year, there's a lot of attention to what the candidates stand for and why they want you to vote for them. Rarely does this conversation include information about children's health or priorities for children's health policy. In May 2012, we asked a group of over 2,100 adults across the country what they thought the top priority should be for children's health that they want the presidential candidates to address. The number one concern among American adults today that they want presidential candidates to focus on is childhood obesity. That's not such a big surprise since we know from a lot of media coverage and many research results in the past that childhood obesity is a major problem in the U.S. and the public does want the government to focus on it. The next concern is bullying. Bullying in its so many forms, whether it's in the schoolyard or in the neighborhood, even cyberbullying online. This is an issue that has really come to be much more present in our minds over the last 10 years or so, and is something that obviously adults would like the presidential candidates to address in their campaign. The third most commonly identified priority for presidential candidates is drug abuse. Although fewer kids are using and abusing drugs today than a generation ago, drug abuse is still a major problem that needs to be addressed in the medical and public health worlds. The public understands this and also understands how a drug habit in childhood or adolescence can become a major health problem in adulthood. And the fourth most common priority was child abuse and neglect. This is an issue that local governments, state governments, and the federal government all have to deal with. The public wants the presidential candidates to address this major problem that too often doesn't get the attention that it deserves from policymakers. When it comes to these four problems, there were no differences by political party. Republican, Democrat, Independent, Moderate, whatever the political party affiliation of the people who answered this survey, they agreed about these four choices. There were also no differences by race or ethnicity. So when it comes to the presidential candidates focusing on these top priorities, childhood obesity, bullying, drug abuse, and child abuse and neglect, we have a consensus among U.S. adults about how they like to see the presidential candidates focus and then act once they do become president in 2013.